you for the honor of being invited. Even long distance, I knew this was going to be a great experience. And so having been in Bangkok, Thailand, and Seoul, South Korea, it's kind of a rude shock to come back to the Upper East Side, but it's also wonderful. I actually spent 5 years right at this address and was actually hit by a car at the corner of 69th and York. So I know this corner very well. Anyway, I want to thank Zach for the honor of being invited to present a lecture to this distinguished audience. And it's really a thrill for me to be here to have the opportunity to address you. I've been asked to discuss a topic that's very important to me. In fact, it's one of my favorite topics, and that is the topic of informed consent. Now, how many of you, actually I shouldn't even bother asking, but how many of you have been involved in an experiment, where you have been an experimental subject? Okay, quite a few, and I guess maybe now you're doing some research too, so this should be something that will be near and dear to your hearts. Well, I hope to challenge some of your thinking as we move along today and consider some of the moral dilemmas that are presented in research thanks to our technological imperative. The technological imperative states that if the technology exists, you use it. Okay, so if anytime you have a new advance, new discovery, we tend to think this is the greatest, and so we always use it. But I believe we must keep in mind, where's the down? Oh, I guess. So I believe you have to keep in mind the ethical imperative. And that ethical imperative states that in research and medicine, if your actions, whatever your actions are, they should be guided not but what we can do or you can do, but rather what we should do. And that's a very important mantra. So today I'm going to take you on a very brief tour of research ethics, and it's brief both because the actual field is very, very short, only about 60 years old, and our time together is pretty short too. The central question that we're going to explore is, why is informed consent so important to us? Along the way, I'm going to provide some applications of informed consent that pose very exquisite challenges. So let's begin. Now, whenever researchers depart from standard medical practice and seek in their treatment of a patient to obtain new knowledge, they are engaging in human experimentation. And make no mistake, this striving is very important and a vital aspect of medical practice. In protecting the rights and safeguarding the welfare of research participants, one of the fundamental tenets is informed consent. A product of our Western ethical perspective is that we place ultimate value on the individual. Sometimes this value placed on the individual conflicts with another value, which is what is best for society. I believe, and I trust you all believe, that we need to protect the rights and safeguard the welfare of those who need our protection. And in this particular case, we'll be talking about the volunteers themselves in research. And it reflects on how we as a society value and respect the vulnerable among us. And make no mistake, at some time in our lives, we are all going to be vulnerable. Anybody recognize this document? Anyone? I think you're close. It's the Hippocratic Oath, right? It's one of the earliest statements pertaining to how physicians should conduct themselves, and it was written somewhere between the 6th century BC and 1st century AD. So it's an ancient document. Now, human experimentation was not explicitly mentioned in the oath. Nonetheless, the oath's most important and well-known principle, primum non nocere, above all, or first of all, do no harm, has become a guiding force for medical practice. And in addition, there's a very strong caution to protect privacy and hold in confidence what is learned from your patients. And all medical students, before they become full-fledged physicians, will cite some variant of this oath. Now, moving along many centuries, in 1914, Benjamin Cardozo, who had just 1 year earlier been elected to the New York State Supreme Court, expressed one of the great fundamental rights of persons. That's the right of autonomy, the right of the individual to determine what should be done to his or her body. In his decision on a case of assault and battery on a patient, he wrote, "Every human being of adult years and sound mind has a right to determine what shall be done with his," and I've added her to be politically correct, "her own body." Now, it may be of particular interest to this audience to know that the case was actually a case that involved the New York hospital. In those days, we didn't have PET scans and CAT scans and specialized x-rays, so when people had surgery, it often had to be done in 2 stages. First, there would be the surgery to see what needed to be done. In this case, a woman had fibroids in her uterus, so you would open up the uterus and see the fibroids. Then you would close her up, and then you would, when she recovered from the anesthesia, you would ask her, "Well, you know, I saw these fibroids and your uterus looks in really bad shape, and I think we ought to remove your uterus. What do you think?" And then they would have a second stage and actually remove the uterus. Well, in this case, the doctor opened up the uterus, saw the fibroids, and thought to himself, you know, it's ridiculous to have to do 2 stages. I'm right here. I can remove the uterus, no problem. It'll save her an extra surgery. So he went ahead and did it. Well, she was outraged, and she actually sued. She sued the doctor for, at that point, removing her uterus without asking her. And, in fact, she won the case. But she didn't win any money because, in fact, the doctor in those, it was a technicality, the doctor in those days was employed independently and was not really on the staff of the hospital. So the case never went anywhere. But this very famous principle that we all recognize as so important has lived on. Well, in thinking about informed consent, I think it's essential to spend a few minutes discussing the Holocaust and the Nazi pseudo-experiments. Some have said that to discuss the Holocaust really in no way can adequately describe the hideous atrocity, but I do believe that it's obligatory to present this topic, not just as a commemoration of the 12 million who died in this conflagration, but because it should serve as a generic caution against the passivity that characterized individuals as well as nations, which knew so much and did so little. And we see these things happening even today. You know, when you think of some of the atrocities that are taking place that we know of so well. Darfur, for example, being one of them. Now, it's important also to keep history in mind because, as we know from George Santayana's well-known observation, those who forget history are doomed to repeat it. Well, during the 1930s and 40s, medicine and human experimentation reached their nadir in the events that and the acts against humanity that were carried out by the Nazi regime. These acts now seem so incredible that it's difficult to believe they actually took place. And in fact, there are people who are trying to rewrite history and claim that they never did take place. Yet there are others who firmly believe that only by learning about this period are we able to say with true sincerity, never again.